Tonight's Health Watch, encouraging news for people struggling with obsessive compulsive disorder, or OCD.
Yeah, it's not drugs or talk therapy here. This is brain surgery. CBS 2's Dr. Max Gomez explains why this may be the best option for some. Dr. Max?
Yeah, that's right, Christine. You know, we've all seen some funny depictions of OCD. People who have to repeat certain routines like washing their hands or checking that the front door is locked over and over and over again. But severe OCD is no laughing matter. It's a disabling mental disorder. Randy Hurt has severe obsessive-compulsive disorder. It became so bad he couldn't keep a job.
I needed to take a shower, and I needed to do certain things. I needed to eat breakfast or whatever, regardless of how much time I had. I think it was 17 jobs in 4 years.
The obsession is something that is, the person knows is unusual and silly, but the person can't control it, and the thought itself causes marked distress.
The customary medication and talk therapy didn't work for Randy. Then his mother came across a possibility of surgery. It's called deep brain stimulation. Thin wire electrodes are inserted into tiny brain areas to disrupt nerve pathways that involve action, motivation, and reward processing. Small electrical currents disrupt the amount of reward a person assigns to their repetitive, compulsive actions.
Patients are kind of fully awake at this stage, and we have a kind of a rating scale device where they rate how severe their OCD symptoms are at that time.
Over the next several weeks and months, the electrical settings are adjusted. Since his surgery 4 months ago, Randy can work on his car and mow the lawn, which he couldn't do before. But
I would like to work again at some point. I would like to get back to work.
I think we're just beginning to figure out the types of patients that we can help. And so I think there are quite a number of people that in the future are going to be helped by deep brain stimulation.
now, even though deep brain stimulation has been done thousands of times for Parkinson's, epilepsy, and even depression, no one is advocating it for anyone but the most severe cases of OCD that have failed all other treatments. The procedure is FDA approved, and it's usually covered by insurance as long as you go through all the other treatments first.
Last resort.
Last resort.
Thank you, Dr. Max.
You bet.